in hearing, I think Dr. Chadha is a name that everyone recognizes. So as probably many of you realize, Dr. Chadha is herself an otolaryngologist, but for many years, many years, even before joining the WHO, has always been interested in the public health aspects of how we actually deliver care. Dr. Chadha now leads the global program on hearing care at the WHO, the World Health Organization. And there, she's basically really responsible for helping shape the global hearing health agenda. In particular, over the last several years since taking over there, she's led the World Hearing Day, which is on March 3rd, which passed about a month ago, the Make Listening Safe initiative, and probably most importantly, and really the culmination, I think, of all our efforts over the last few years, has been the recent World Report on Hearing, which was just released last month, which is a multi-year effort involving collaborators and stakeholders around the world, which helps really advise governments and lays out a blueprint for many countries around the world to how to begin addressing hearing care. So Shelly, we're absolutely thrilled you're able to join us. It's clearly one of the advantages of having a virtual seminar that we're able to get you to join us. So please go ahead and share your slides now, and we're very excited to hear your talk.
Thank you, Frank. Thank you for that very kind introduction. And thank you also for this amazing invitation to be here, to be a part of this very interesting, I'm sure, academic discussion. So it takes me back to the days of my being a professor, and which was a job I really tremendously enjoyed. But I'm also happy, very happy to have shifted jobs and now be in this role, which I also very much enjoy. But it's always great to be able to connect with students. So thank you very much. I appreciate the opportunity and to be a part of your center's discussions. So I want to take you on a brief journey, which is a journey into the future, into the year 2050. A year by which there will be nearly 10 billion of us inhabiting this planet. Nearly 1 out of every 4 of people at that point, it is anticipated, could have some degree of hearing loss, mild to profound, which means that nearly 2.5 billion people would have some level of hearing loss, of about a third of which, so over 700 million, would be in need of hearing rehabilitation services. So this is what is anticipated for the year 2050. The world will be potentially a very different place in 2050 for those of us who live that long. A world with, artificial intelligence becomes the norm, and a world of self-driven cars and cutting-edge technology. A world in which the field of hearing technology would also have made further great advances, and potentially we would have the kind of hearing aids that everybody still dreams of having at an affordable cost, and also newer kinds of implants, much more effective, much more efficient, and so on. But what would it mean? What would this mean for this child who is born, let's say, in 2050 in rural Rajasthan in the western part of India, who's born deaf and whose mother is still waiting for him to start speaking? What does it mean for him to have all these technological advances? What does it mean for this grandfather whose whose kids are, and grandkids are a bit irritated with him because he forgot the plans for the day, whereas the fact is that he never even heard what they were discussing the evening before? In order to make a difference, that this technology makes a difference in the lives of these people living in all parts of the world, clinical and technological advances must be supported by public health action. And this kind of public health action, this kind of public health approach, which is essential for us to take these advances, to take these to the masses who do need these services, is what the World Report on Hearing defines, what it outlines. So what it sets there is the why. Why is it that we must focus on hearing, and why is it important for the future, and why starting now? Why is this important, and how can this be realized? How can this aim of making hearing care for all possible be realized? So what this World Report does is it puts together um, the public health framework for hearing across the life course. It is possible to have hearing across the life course through public health action, that being the central message of this report. And how it does this is, as I said, by setting out the why, by outlining the epidemiology of hearing loss, the current epidemiology of hearing loss, projections for the future, also identify what are those risk factors that we need to focus on very strongly. So just to give you some examples, for examples, it outlines the issue of listening to loud sounds, which is posing a risk to the lives of millions, potentially over 1 billion young people. Also outlines the issue of otitis media, but it also looks at other risk factors like occupational noise and so on. It sets out there that, majority of those people who live with hearing loss actually do so in low and middle income countries of the world. Well, majority of the population of the world lives in low and middle income countries, but it outlines what are those profiles for those for hearing loss in these places, and identifies what are the gaps in services across the world. So in terms of tracking one tracer indicator, in this case, access to hearing aid, it identifies what is the gap in services across the world. And it identifies what is the cost of this unaddressed hearing loss. What is the cost of not addressing hearing loss? So it sets the stage for public health action, so to say. And then it poses solutions. So solutions in terms of what can we do to prevent hearing loss? So starting from prevention, what is it that can happen, and how effective public health strategies and clinical interventions can prevent the occurrence of hearing loss? How can early identification make a difference? So how is early identification even possible at different stages of the life? What tools are available to us today and can be available to us in the future? So what needs to also be developed, and what strategies need to be honed in order to make sure that people in all communities, whether it's rural Rajasthan or whether it is East Coast of the United States, these services can be made available for all people. So how can early identification be made a reality in all parts of the world? It also sets out what are the solutions available in terms of rehab and care. So what is it that is available to us, and how can this be put to use in terms of making it accessible? It then identifies and acknowledges the challenges, because ultimately, if we are to move forward, we must understand what is it that is impeding us, or what is it that we need to overcome, and then systematically think of ways to address those. So it identifies the challenges in the field of hearing care in terms of, challenges. Firstly, the growing number of people with hearing loss, so the growing need for hearing care. Also, challenges at the level of the health system. So, whether it is in terms of health workforce or health information, lack of policies or medical devices and products, equipment, financing. So, it looks at all of the health system building blocks and picks out what are the deficiencies in each part of these. It identifies the challenge of limited knowledge and awareness about hearing care at all levels in the communities, and also focuses on stigma, which in a way if I think of it, it kind of binds our field and it prevents the growth of ear and hearing care. It prevents the uptake of devices, even the best of them, in the highest income level countries. And also the awareness, the uptake of services for ear diseases. So these are often limited by the stigma which is associated with hearing loss and hearing care. So it identifies and frames all these challenges, and then it defines the way forward, which is through integration of people-centered ear and hearing care within the health systems. So integrated people-centered ear and hearing care, which is, the concept is defined, is described there, which is essential so that people can have equal access to quality ear and hearing care services within the framework of a supportive environment. And it frames, well, what this means. So it identifies a set of integrated a set of hearing interventions which need to be integrated. So need to be integrated and delivered through strengthened health systems. So it identifies these interventions for ear and hearing care, which are essential and key for countries to consider as they develop their national health systems for ear and hearing care. They must look at these and prioritize them according to their own situation. It also provides or refers to those tools which are available from WHO to do the situation analysis, to do the planning, so that countries can ultimately deliver these services through strengthened health systems, because the integration needs to be within the framework of health systems, within the framework of universal health coverage. So it identifies what are the building blocks and what all needs to take place at each level of the building block so that these services, the hearing interventions, can be made accessible from the primary level right up to the tertiary level. And finally, what the report does is it identifies what is the cost of this what is the cost of implementing these interventions, of integrating these interventions, which it estimates at about an annual cost of $1.3 per capita. And when we say per capita, it is the entire population, not people with hearing loss. And that this investment is something which over 10 years has the potential to benefit 1.4 billion people with hearing loss and ear diseases. It has the potential to avert 130 million disability adjusted life years and to bring a return of $16 over a 10-year period for every dollar that is invested in this. So this is what the report does to frame what is the path ahead for the future. And finally, what it does is it sets out targets that we must achieve by 2030 in order to move this field in the direction, in order to make sure that by 2050, we are in a much better place than where we are starting out today. So it calls upon member states also to integrate and to work towards the achievement of these global targets. And ultimately, it makes recommendations. It calls for action by member states, by the governments, ministries of health, giving clear-cut direction, but also by international and non-governmental organizations, by professionals working in the field of ear and hearing care, by researchers, by civil societies, and by private sector entities. And it calls the world to act now for the future, for a future where people-centered ear and hearing care is integrated, is an integral part of universal health coverage, and is provided to people from the primary to the grassroots level in line with the principles of universal health coverage, where they need these services, when they need them, and without facing undue financial hardships. Because the cost of doing nothing is one which we cannot afford. So I'll stop here and I'm available to answer any questions about it. Thank you.
Thank you so much, Dr. Chadha. I think in the interest of time, what we'll do is we'll have basically both speakers present, and then we'll have sort of more of a panel Q&A at the very end. But Dr. Chadha, thank you for that wonderful overview, essentially, I think of broadly the World Hearing Report in a nutshell, which is not easy to do, but focus on the big concepts. Now, I'm really thrilled to also introduce Dr. Audra Renyi, who I've known for several years now and who I've just been honestly always so impressed with. Audra comes from a finance background. She previously worked in private equity on Wall Street before later going on to establish and being the executive director of Worldwide Hearing, which for those of you, anyone in the sort of the hearing care space probably heard of it. So they're the ones who have really provided hearing care at scale to children in communities around the world where there really is essentially no hearing care. So again, I always say this research is great, but unless you can put into action and actually influence people's lives, it doesn't really matter that much sometimes. So I think Audra is a wonderful example of someone who's done this, both through Worldwide Hearing and I think most recently too in founding Ear Access, which is a for-profit social enterprise also focused on hearing and access and provision around the world as well. So Audra, we're absolutely thrilled to have you talk to us today and give us your perspectives on where you see the field going and what you've done so far. Thank you.
Great. Well, thank you very much for the kind introduction, Frank. And slight correction, we're not a doctor, so I just wanted to make that point. I don't want to take credit where I'm not a doctor by training, but I do have kind of a finance background, so came at this from a bit of a different angle. And so I'm just going to share with you my screen here. Great. Well, again, it's a pleasure to be here, and thank you again for the opportunity to share a little bit about the work we do. Today's presentation is really one specific approach to equitable access to hearing care. And specifically, I'll be talking about some of the work we've done at Worldwide Hearing. Worldwide Hearing is a nonprofit. We're headquartered in Montreal, Canada. And our mission is to provide access to affordable hearing aids and hearing care, mainly to children and youth in low and middle income countries, and more broadly in underserved communities. We also work in, for example, in Indigenous communities in Canada. We're mainly focused on children, but we also work with older adults, and in particular, in a family-centered approach, we fit, for example, parents of children with hearing loss who need hearing aids. If the parent also has hearing loss, we'll fit them with hearing aids. We fit teachers, etc. We work through a social enterprise model, and our goal is really to make a powerful impact on poverty, mental health, and education. Our solution is based on 3 pillars. The first pillar is affordability. So we source high quality digital hearing aids, new hearing aids, at very low cost from a wide range of manufacturers. We're essentially tech agnostic. And in our typical model, we'll work either directly in the field in our partner countries or through partnerships that we support in country. And we will, in our case, donate the hearing aids, but we really encourage the partner to charge, even if it's a small nominal amount and a small fraction of the subsidized cost sometimes of the hearing aid. We think it's really important for people receiving the hearing aids to contribute for buy-in. We see that this has an impact on how well they take care of the hearing aid over time, how much they use it, they feel more invested in the solution. And it also generates some additional income for the people on the ground providing the solution to keep paying for the ongoing care, because the hearing aid is often only the first step. It's the 5 years or more it takes and the ongoing care that is needed and follow up. The second pillar is delivery. So we train people, mostly women, in the communities in which they work to be able to fit hearing aids and provide diagnostic services and hearing care. Again, in this model, we also encourage them to earn some revenue so that they can, there's really a livelihood aspect of this as well in terms of job creation locally. And the third part is really more tech-centered. We use a wide range of technologies, but most recently we've built our own platform, which is called the Remote Audiology System. And this really supports all the other field work we do and helps bridge the gap between the more remote communities and the health centers or the clinics. So it's made up of a mobile screening app, which can be used by community workers, teachers, healthcare staff. There is a portal for hearing care professionals. So that's the audiologists, doctors, administrators, so that they can get a snapshot of what's going on, but also have immediate access to more complex cases and make decisions on the spot in terms of referral networks. And then now, most recently, we're working on building the patient portal, which is the patient-facing app. And this technology, we've built as Worldwide Hearing, but it's really an open access technology. So we make it available and free to anyone in the world or other organizations that want to use it. Our goal is really just to accelerate the equitable access to hearing care across the world. Just a quick snapshot. So this is what kind of the home screen looks like in the app. So you can see, you can capture patient history, follow up on the hearing aid, the type of hearing aid. You can put the serial number in, all that stuff, payments, if in the case there are payments, otoscopy, tympanometry, OE, audiometry. So it does a bit of everything in one place. And then this is just another snapshot of part of the portal dashboard. So this is just gives you real-time access to what's going on at the more macro level, so that we can see in real time, if there's interventions that have to be adjusted, or we can kind of get a big picture view of what's going on. So broadly speaking, in terms of our impact, we have today worked actively in 7 countries on the ground, including Jordan, Vietnam, 8 countries, Jordan, Vietnam, right now, Kenya. Right now we're active in 5, so in the Philippines, Guatemala, Peru, Zimbabwe, and Indigenous communities in Canada. Through this work, we've directly impacted the lives through our hearing care and hearing aid program of over 140,000 people. Most of them are children in these countries. And from our perspective, we're just getting going. This is for us a year and in the next couple of years of really scaling both within the countries where we're working and more broadly. I'd like to talk briefly about the COVID pandemic, because when we're talking about, as Shelly mentioned, you see there's these huge gaps in between the need for hearing care services, hearing loss interventions, and the actual provision. And this gap is only growing to some extent, unless we do something about it now. And the pandemic has further exacerbated the inequitable access, if you will, to hearing care. In particular, in low-income countries, in particular, we've seen it across. Women have been more impacted, Indigenous communities, remote communities, and so some of these challenges. I'll just mention a few that we've seen across our partner countries around the world. Clinic closures and lockdowns. So. That we've seen a lot of hearing aid users no longer had access to batteries. They couldn't travel because of restrictions, delays in timely ear and hearing loss interventions, and people with hearing loss who often already felt relatively isolated, felt even more isolated, and this has had negative impacts on mental health in particular. School closures. So in Peru, where we work, we have our own staff directly in Peru, and schools have been closed since March 2020. They never reopened since. It's been now at 14 months almost, or 13 months. So that hasn't made in-screening in schools, in-person screenings possible. Lower income families who lack access to internet, data, computers, bandwidth is still an issue in a lot of the areas. And I'm not just talking about Zimbabwe or Peru, I'm talking about Northern Canada as well. We have major bandwidth issues in terms of people being able to access telehealth services. Opaque face masks. So face masks have made it harder for people with hearing loss to actually hear each other, to hear their caregivers, to hear family members. And even people who wear hearing aids rely a lot on lip reading. And without being able to read lips, it becomes very challenging for them to understand. Another thing we've seen is public hospitals that have stopped purchasing hearing aids because of budgetary restrictions or have postponed purchasing hearing aids. That again limits the amount of available free or subsidized or public hearing aids in the health system. So we looked at, over the last year, we've looked at this. We've come up with some of the solutions, some solutions to some of these issues, and I'd like to share a few of those with you today. Specifically, we started immediately shipping hearing aid batteries to people's homes directly in where we already had patients, clients in the different countries. So we'd use Uber, Courier, whatever worked. We just wanted to make sure that no one went without batteries during this period. We also used Tele Audiology and shifted to online. So for example, using remote hearing tests, remote hearing aid programming. We provided hearing care support over the phone, WhatsApp, Zoom, and sometimes for people who might not have access to anything but a basic cell phone, we would use text messaging. Whatever worked to make sure that we were in constant touch and be able to provide the ongoing hearing care to our patients, to the people we serve. We also created training videos on YouTube to make sure that both the users and also some of the people providing the services were trained on proper hearing aid hygiene during the COVID pandemic, making sure the hearing aids are clean. So some of these really basic practical tips during the pandemic. We also, thanks to support from the Red Cross and the Government of Canada, we launched a transparent face mask project here in Canada. So it created employment for Indigenous women to actually sew the transparent masks. And we donated over 8,000 transparent masks in Indigenous communities across Canada. This is just a quick picture of where we donated and created some of those masks. So you'll see, for example, in the Arctic region of Nunavut, which is the territory, the Arctic territory, their hearing loss is particularly prevalent. It's some of the highest rates of hearing loss in the world. In fact, some studies are showing that as many as about 40% of children have some hearing loss, mostly due to chronic otitis media, and that's compared to 3% in southern Canada. These are the areas that we thought were particularly important to serve during the pandemic and make sure that people with hearing loss were hearing their teachers, their caregivers, et cetera. In elder centers, we donated as well. And I'll talk also briefly just about our solution we worked on in Peru. Peru, as I mentioned, we have a school screening program there. And unfortunately, schools have been closed. So we thought about ways around that and creative solutions in terms of reaching those kids and screening kids nonetheless. And so we developed an online screening questionnaire. This was really based on the child questionnaire for hearing screening, which is a validated questionnaire, I believe, originally from the US. And we adapted it to Peruvian context. And the first thing we did was try to promote it online on social media to encourage parents to fill it out on behalf of their child. Didn't have a lot of success with that. People were not responding or fully completing the questionnaire. So we tried a different approach, and we really looked where can we meet the parents? Where can we get them in person? And so we decided to partner with a program called Caliwarma, which is a government-run national program in Peru that is a food program for public and lower-income schools, essentially. And so usually they're providing food every day to the children, but during the pandemic, they were organizing once a month visits by the parents, and the parents would get a big basket of food for their children. And so we partnered with that program to show up on the day that the parents were showing up and administer the questionnaire to the parents, with social distancing, PPE, all that tablet-based technology. And that was all that data was going directly to the cloud. So we were getting that data in real time. And so through that program, in just a matter of a couple of weeks, we screened over 7,500 parents through this questionnaire. And it was very successful in terms of starting to reach larger numbers of kids indirectly screened by proxy through this questionnaire. So here's some of the results, because we thought, we're still compiling the data. We're still in the process of fitting hearing aids. So these numbers are not final by any means, but I want to share with you a little bit about what that looks like compared to a traditional screening program that's in person. And so what's interesting is that at the end of the day, in terms of percentage of children, these are younger children we're talking about fitted, they're very much similar percentages in terms of the baseline of how many, in terms of percentage of how many people we actually screened, children we screened. On the left-hand side, you'll see this is the results from the online questionnaire. We clearly had more false positives and over referrals in the process. So we had to clinically assess, at least at this time, it's a snapshot in time, but at least 3 times more than we did when we did the in-person screenings, which is more accurate at detecting the hearing loss. But The counter side to that is in the process of speaking to parents, we're actually educating and raising awareness about hearing loss and milestones and things to watch out for, which doesn't happen in school-based screenings, because the parents, though we have sessions for the parents, only a small fraction of the parents show up, and they don't have a great sense of what's going on when we do the screening. So we're actually post-pandemic looking to really use this tool in parallel to in-person screenings, because we think there's a lot of value in terms of ways of educating parents in the community in the process. And so the next step for us is also to validate this sort of adapted version of the questionnaire that's been adapted for the Peruvian context, and publishing some of that data. And I also want to just mention that screening, school-based screening is probably not the most cost-effective way to identify people with hearing aids, if that's your ultimate goal. And we recognize that, but that's sort of a separate part of our program. Most of the large number of hearing aids we do is through hospital networks, referrals, schools for the deaf, social media campaigns, community outreaches that are more targeted to people who most probably have hearing loss. But school-based screenings have, apart from identifying kids who have hearing loss, has a secondary and really important function to it, which is prevention and early identification of other things. It can be ear pathologies and other things. In Guatemala, for instance, on average, about 30% of especially the younger kids who are screening, have some cerumen or earwax blockages that we end up removing through, on the ground. So we identify otitis media. Occasionally, once in a while, there is a tumor that ends up getting referred to an ENT. So this is part of a multifaceted approach in terms of both prevention and actually identifying hearing loss and treating and the rehabilitation piece. Just I'll share briefly with you some of the key lessons that we've learned along the way. Really, I think, as echoing also what Shelly was saying, is that really putting the patients at the center of the solution, right? And ensuring the solutions are designed for the beneficiaries, users, whatever term you like to use, but ultimately they should be at the core, not just at the center of the solution, but helping co-design that solution. And just to give a concrete example, we certainly had our hypotheses on what we thought the pandemic had, how it had impacted, people, our users, our hearing aid users and patients. But we really started with a questionnaire and really interviewing them and understanding where the gaps were. And so everything we did, we tried to really do it as an answer to the things we were really hearing from the ground, as opposed to coming in with our kind of preconceived ideas of how this may or may not have impacted their lives. And the idea of empowering local communities through training, making sure there's sustainable programs in place, making sure that ultimately they can manage locally is really the goal, versus a more of a fly-in, fly-out model. Low tech can help bridge the digital divide. So a lack of high-tech equipment is not an excuse for inequitable access to hearing care or for not doing anything because we don't have the technology. And I think the pandemic has really reemphasize that point, because there are other ways, and going to a questionnaire, which might seem more basic than a really nice fancy digital audiometer that's cloud-based, that's all very nice, but questionnaires can actually, as I've shown before, it can give a relatively good amount of accuracy in terms of getting as a proxy for hearing screenings. So especially in places where internet is less reliable, there are other ways of reaching people, and there's always a creative solution to do that. Partnerships are key. I already mentioned that we're looking right now at validating the questionnaire, kind of the next steps on that. And in fact, if anyone is interested in helping us on any aspect of that project, we're more than happy, to accept any help we can get on that. We're working with the local university, but this is something we've been asked approach with and said we'd like to scale. They like what we're doing. They like to scale to other countries, but people need the evidence base and the data, and so that's what we're working on. Government partnerships. I think again going back to Shelly's point about the solution to access to hearing care and equitable access to hearing care is really it's a multi-stakeholder approach, and public health and government has to be a big piece of that. policies and scaling of programs by government is ultimately one of the most sustainable ways of really getting something, across a country, across a region, in partnership with NGOs, private sector, et cetera. But that's a key part of the equation. And so we're increasingly as an NGO working with governments in collaboration with governments. I would say one of the things that we've learned along the way is that, it's not enough to have you build a program, a pilot or a program for 2-3 years. You have a lot of success in terms of the results. And then, we'd go to a government, Minister of Health, Education, and say, look, would you like to help us scale this up? Are you interested in? And they say, this is great, but where's the evidence base? And you have peer-reviewed, research that's been published. So we didn't, because we sort of waited until the project was ready to really scale to start that work. So now that's certainly one of the learnings we've done is to, from the get-go, before we even start a program, to engage with the researchers, to engage with the governments, to start measuring that over time and proving out the impact. And in particular, with the governments is having those discussions, bringing in the stakeholders early on and asking them, what do you need? Where are your constraints? What do you need to see down the road in 3-5 years for this to eventually be taken up by the government? So that's something I'll concretely mention in Canada. We're pretty excited about that. Just happened 2 months ago. We had been working in Indigenous communities for several years now on several programs across Canada. And 2 months ago, our team that we'd helped put together, which is really a northern-led team run by the Inuit in northern Quebec, won the largest innovation prize in Canada for this kind of work. So it's a $500,000 prize. And that specifically will go towards creating a local entity incorporated in the north, for the Arctic region, and made up of stakeholders from the Ministry of Health in Quebec, from the Ministry of Education, from the local Inuit community, and audiologists, EMTs, et cetera. And we're part of that. We're just one partner amongst several. We're really, really proud of the fact that we helped catalyze that change. And then ultimately, this is no longer, a worldwide hearing project. This is a northern-led Inuit project for the Inuit. We're still part of that, that group. But that's ultimately what we aim for, is to work ourselves out of a job. And we're really happy when we see that, because that's ultimately how we think, communities should take ownership of the solutions and not be constantly dependent on outside. In the north, it's a question of being dependent on the south, on audiologists from Toronto, Montreal, and but really have their local solution, training people locally to provide the care in community. So that's just a little bit about how we're as we go forward. These multi-collaboration stakeholder partnerships are really part of the solution as we see it as we move forward. They're not easy to do and they take a lot of time, but it really ultimately is very rewarding when you can see change happening in a big way. So